Welcome to another episode of Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician who helps patients understand what are their options, how to be able to heal brain and body, and how to be able to punch pain in the face and get back to leading the life they deserve. Today, we're talking about fancy acronyms. So acronyms like EEG, QEEG, and ERP. I know that sounds very fancy, but we're going to explain it so you understand it and you're not going to just turn around and leave. So let's start from the beginning. So what do these different acronyms represent? EEG stands for electroencephalogram. What exactly is that? It is an electrical evaluation of the brain to see the various different electrical currents that are present. Historically, it's been used to be able to evaluate and see seizure activity, but we can utilize it to be able to understand other problems that are present, particularly things like depression, right? We're going to give you representations of what that really means and how it all kind of comes together, but just explaining the simplicity of it. QEEG, which is that Q before the EEG, is quantitative. And so what the heck? Basically what it is it's taking those EEG waveforms, which we're going to show you in a second, and using it mathematically to get and garner information based off of a database of a whole host of people to see what is quote unquote normal and what do their brain waves look like and what might someone else's who might be slightly different that may happen to have PTSD or depression or other things, and show how to be able to get back to quote unquote traditional waveforms and how to be able to improve things. And finally, the last one, ERP, has a whole host of different things. In neuroscience, it's evoked, but that's not what we're talking about here. What we're talking about is something that's called event-related potentials. And we're going to explain exactly what that is. But it's specifically a certain event that takes place while you have electrical monitoring that allows for you to be able to have a more accurate determination of your problem and issue that may exist, that may even be better than these other two methods. Why do you want to know these things? Because genetic testing for what you might have only goes so far, and being able to look at this from a different dynamic is a way to be able to understand what's happening with you and seeing how the treatments that are being provided are actually working. So let's take a step back and look at one of the main reasons why we might want to do this, period, and that's depression. So when we look at depression as a whole, it's normally classified as having issues with sadness, having issues with loss of interest in normal activities, and it is common. Over 700,000 people kill themselves every year due to major depressive disorder, and it affects more than 320 people worldwide. Prior to COVID, it was maybe 7% of the United States population. Since COVID, it has spiked to 27%. So nearly almost a fourfold increase. So what we're talking about, as we've talked about in other videos, we've talked about different treatment therapies and how to be able to deploy them differently than just medication alone, because many times, as we know, medications just hasn't been successful and they haven't worked. So in this video, we're talking about how can we be able to evaluate depression, and is it the same for everyone? Is there a way to be able to really have a better understanding of what might work and what might not? So let's take a look at some of the ways that we're able to capture some of this electrical information and be able to then process it. So some of the different headsets, particularly on the right-hand side, allow for you to be able to evaluate what's happening from an electrical standpoint. Traditionally, the more contacts you have, the better you can be able to assess waveforms and the more detailed information you can get. So some of these are traditional EEGs and some of these are not. At the end of the day, what we want to do is to be able to have an understanding about how to be able to impact this. So one of the papers, as you guys know, we use a lot of papers to be able to assess this, is resting state EEG signal for major depressive disorder detection. one of the things it does is it provides a really quick, simple way to be able to look at this. So this picture is a picture that looks at the 1020 system. So what the heck is that? So what is that? It's a way to be able to, if you take a look at this picture, it's like you have someone who's seated and you're looking top down at their head. So the little triangle at the top is their nose, and little two circles on the left and right hand side are their ears. And so you can see the front of their head, the back of their head, the left side and the right side. And these little places, FP1, FP2, FT7, T3, T4, are places where you'd put a site or an electrode to try to pick up information. So when I talk to patients and even friends, they're really concerned because they're concerned about, are we giving electrical energy into the person and shocking them? That is not what we're doing. Instead, what we're doing is basically we're registering this. The same way as if someone took someone's pulse, they're basically feeling the pulsation, right? They're not providing a pulse to that person. Rather, they're being able to perceive it. And that's what we're doing with this. What we're doing is we're taking that electrical energy that's subtle, and we're using a device to be able to determine what that electrical energy looks like. So if we were to give another kind of cartoon representation of that, it looks like the following. So you have these neurons that have circuits. They traditionally will have an electrical energy that you can see on the left-hand side. And then you have these grouping of neurons that end up producing a much larger signal. And then bigger than that, you have the whole brain that we can be able to look at and see using electrodes, something that's called an electroencephalogram. And that's that EEG that we referenced before. So what does that look like if we were to actually record it? What it looks like is the following. It looks like this, and you can see these electrical energies that are present, the waveforms that are present, and off to the side, you can see different demarcations like FP1, F7, 01, T2. And so how and what is that? Well, if you recall, it's similar to what's present here. It's a reference point between one electrode and another electrode, what the waveform looks like. So what most people would say is that's a lot. Really, how do we kind of like take this and how can we be able to understand this? But basically, this is it. Where it's coming from is we're using this to be able to have an understanding about what's happening with you. And the QEEG takes all of this data that we have here, and it then tries to say, what are the waveforms that are fast, that are slow? Do we have something that's called a beta waveform, a gamma waveform, an alpha waveform, a theta waveform, a delta waveform? And why are those things important? Because they have meaning. So when we look at the aspect of something like a slow waveform, like a delta, it's what's present during deep sleep. If we have a disruption of this, perhaps that person has a sleep issue that maybe we can improve in different ways. If there's a challenge with the theta band, this next highest level, they may have issues with memory, or they may have increased drowsiness. The alpha band is what is traditionally present during normal kind of function, and the beta may be with problems with concentration or have issues with increased cortical activity. But the fact of the matter is we can graphically represent this and put this in picture form. Again, remember that top-down looking formation that looks like the following, where you look and we can see that kind of nose and the ears. And for certain waveforms, we can graph where does it seem to be more prevalent. And why is this important? Because we can get a big picture of the person as a whole. And we can see not only what are their different waveforms in different areas like this, but we can also see how well does the brain talk to itself, which as we've started looking at something that's called neural networks, it's hugely important in terms of not only our cognitive function, but potentially our mood. And by being able to understand that, we can be able to understand different conditions. So we may be able to see, does someone have ADHD? Do they have depression? Do they have anxiety? Do they have migraine? And why these things are important is because if we can see these things, then we may be able to target them in a non-invasive way. For those of you who followed our channel and know about TMS or TDCS, you know that we sometimes apply either magnetic stimulation or electrical energy at some of these sites that then can be able to give us a response like we would hope and expect that work better than medications and give us a real true improvement. So if we know all of this, why use the other fancier thing that's called an ERP? So again, that ERP, as represented in this paper, stands for event-related potential. The reason why is because when we use this in combination with these other studies, we can see improved accuracy. So as opposed to us just guessing, why would we not want to know this in more detail? So an ERP is different. If we were to look at that waveform, which I know this is starting to look a little complex, but bear with me for a minute, I'm getting to the point, is it has a change and a representation of the waveform based on something that's provided as an event. So if we look at that into detail, this is what you can see. You have this waveform that presents traditionally after we give a certain type of stimulus. And this stimulus will have either an increase or a delay in where these different waves show up. And the latency or the increase representation of these waveforms actually can provide us insight into mood. And so that paper that was referenced earlier, this allows us to be able to understand depression even better, because what we're able to see is this waveform that I was referencing previously at the top as a control, and down here are patients that have depression. And what we can see is differences in terms of the peak as well as the onset for different components of this waveform that then lets us be able to make a determination. Is this person having depression in addition to what they feel? And when we change certain things, whether it's a medication or whether it's a stimulation technique or whether there are other forms that you might be able to kind of utilize, whether it's meditation or other elements, how much of an impact are we having? And can we see where we start? So now we have a better idea about where we finish. And in this particular paper, they were really able to determine that there is a difference between the control and the depression, and statistically significant. That was what these little bars kind of show and represent. So much so that they were able to determine that ERP, event-related potentials, are able to kind of give us this idea about whether there's a difference. So why is this important? Why this is important is, so taking a step back, actually in my office today, I had someone come in and say to me, you know what, doc, I really feel like all hope is lost. I'm going to be depressed indefinitely, and I don't think anything I'm doing is going to make a difference. And we talked about some of the therapies and treatments that we offer in our own clinic, which a lot of other clinics may also be able to provide. But at the end of the day, what we want to be able to do is help patients understand what their problem might be, not just what you think, because sometimes being able to understand it, to see it, to represent it, and have a characterization of it, then lets you be able to fight a battle where you really can punch pain in the face and get back to leading the life you deserve, because now you know what you're dealing with, and we can see how much of an incremental improvement we've been able to make and how we can be able to make that be sustainable. If you found this video helpful, give us a like. If you have questions about this, please leave them in the comment area. If this is something that you feel like you want to learn more about and understand topics like this, hit the subscribe button. We love to be able to help you know how your options are and what you can do in order to be able to help heal brain and body and get back to leading the life that you deserve. Thank you so much and have a great day.